The United Nations agency says the funds will be used to support children with adequate and life-saving nutrition services, including treatment for severe wasting. Despite gradual improvement in waste treatment, outreach in the region, the impacts of the COVID-19 pandemic, combined with climate change and ongoing conflicts, continue to push children and families to the brink. Last year, UNICEF reached an estimated 500,000 severely wasted children in Ethiopia, while in South Sudan, where an estimated 1.4 million children under 5 years of age are acutely malnutritioned, the UN agency provided treatment to more than 240,000 children. UNICEF says prevention remains the best way to ensure that children survive, avoid permanent cognitive, physical damage, and evade the long life suffering that results from childhood malnutrition.
Well, for more on this wasting crisis, we're now joined via Zoom by Christiane Rudert, who's the Regional Advisor for Nutrition at UNICEF ESARO. Thank you so much indeed for joining us, and welcome to the program.
Thank you.
These numbers sound frightening. They don't happen overnight. How long has this been building up?
Well, even in the absence of conflicts or sudden onsets like in emergencies like floods, we always have some children who will fall into this acute state of malnutrition, which we call severe wasting. So many countries already have quite a large number of children who are suffering from severe wasting every year. Ethiopia, for example, each year expects to have around 1 million children who suffer from this most severe and life-threatening form. But the conflict, the drought, and other emergencies like floods make this infinitely worse. And of course, the COVID pandemic, which has had a huge economic impact on the lives of families and on their access to markets and food, has just made it worse. It has exacerbated an underlying situation that is already affecting these vulnerable children in many countries in the region.
Why do you think that it's, I'm going to use the word allowed to happen, because we see these things, but it seems as if maybe not enough urgency or effort is put in to make sure that these children are properly fed?
There are a number of factors, and poverty, of course, is one of the factors where families face, for example, food insecurity, they face illness, they face sometimes difficult access to reach services. But UNICEF has been working together with governments and many partners in these countries to try to expand the services to reach every child. This is both services to prevent malnutrition and services, for example, not only in the health system, but also services like social protection, services, water and sanitation, which is also essential to prevent malnutrition, and has really also expanded the network of community health workers who reach communities that are far from health facilities to screen children and to give them information about prevention, about the best ways to feed their children, to advise them about health services and so on. So more is being done. Services are being expanded. In 2021, we will reach around 1.5 million children with this life-saving treatment, and a lot more children are being reached. But then, as you've heard, there's still a huge gap, and more resources are needed, especially now with all the threats that are facing children.
I know that you work hand in hand with a lot of governments in the region, and that's part of the play. We often talk about social support, social protection, and that each country should be putting more and more investment in these areas. Is this one area perhaps that's not getting the attention and the support that's required, helping those families to have enough to feed their children?
Social protection is gaining a lot of momentum in many of the countries. Ethiopia, for example, does have a social protection system, and it is being expanded. Kenya also has a growing social protection system, and many other countries are beginning to introduce this with support from many partners. And of course, the challenge, especially now in the context of the economic hit that many countries have faced as a result of the pandemic, the fiscal space is very challenging to find, to make sure that the transfers that families receive are adequate and that the coverage, the scale of the transfers also reaches all those in need. There's still much further to go, but we're very optimistic that the systems are being put in place and more children and families are being reached.
Let's talk a little bit more about the children and this wasting phenomena. What are the consequences of this? What if left unchecked and this problem persists, what is the long-term effects for these children?
Well, wasting is one of the acute forms of malnutrition. It happens quite quickly when a child faces a sudden event like a flood, where they're suddenly away. They've lost their homes, they don't have food. It may also take a little longer if there's drought and there's prolonged sort of depletion of the food security of families. And on top of that, if an illness like diarrhea or malaria takes place, the child with wasting is 9 times more likely to die. So that is the consequence if left untreated for many children. A child with severe wasting is 9 times more likely to die than a child who is well nourished. Other forms of malnutrition, which may often go together with severe wasting, which we also call stunting, is a longer, more chronic form of malnutrition, which has long-term impacts on growth, on development, on learning, and of course the potential of a child to earn a living. So all of these long-term effects are faced by many of the children in countries that have 30-40% rates of stunting that underlie these then acute threats that happen, like droughts and floods and the impacts of conflict.
What sort of age groups are we talking about that are most vulnerable, that you're most concerned about?
We are most concerned about the youngest children, those aged under 2. They are most vulnerable, and we even see very young infants that are affected, and they, on top of having a concurrent illness or other complication, they are extremely vulnerable. So those are the children of most concern.
Yeah, and I just, we talk about the immediate issues, but I suppose when we start talking about issues like stunting, some of this can't be reversed if left unchecked for a prolonged period of time.
That's correct. And we have a very small window of opportunity to prevent stunting, and that starts during the pregnancy, when the mother needs the best nutrition and health care and support that she can receive. And then the infant needs the best start in life with exclusive breastfeeding within the first hour of birth and up to 6 months. And from 6 months to 2 years, they need what we call complementary feeding, that is nutritious and healthy and nutrient dense. Things like eggs and milk and animal source foods and protein and lots of different types of vegetables. Otherwise, the child misses that window of opportunity. Once a child is stunted, by the age of 2, most of the stunting will have occurred, and it's very difficult to reverse. And a child will then suffer those deficits, both of growth and health, but also, as I said, learning and earning.
So this is very, very urgent, isn't it? I mean, every month that goes by is maybe a month too long for some children. What kind of help and assistance are you needing as UNICEF to get the job done?
So the figure of 255 million that was mentioned earlier is for this year, and it is to provide urgent life-saving, both preventive interventions and the treatment of those 1.5 million children who the current resources from UNICEF and from other partners and governments cannot reach. We estimate that there will be resources, as there were last year, to reach around 1.5 million, but not the other half. So we have an urgent need for these resources so that we can reach the children. The systems and personnel are in place. The services and the community workers are there, but the supplies are not there for all of the children. And there are also interventions that need to happen beyond the health system to support prevention, to prevent the children falling into that severe form where they need the life-saving treatment. Prevention, including the social protection, the cash transfers, food security, water and sanitation and healthcare. All of those together help to build the resilience and to help prevent the life-threatening form of severe wasting.
All right. I mean, it's such a sad story that we're talking about, but I want to end perhaps being a bit more positive, and that much can be done if you do get this help, that it's not a hopeless cause.
Absolutely, and we've seen, steady progress in the number of children reached and in the coverage also of the prevention package of interventions. And so with some more resources, we can both prevent more children from becoming severely wasted in the context of the threats that many of the countries like Ethiopia, Somalia now with its drought, South Sudan, Mozambique, Madagascar, all of those countries, we can avert the situation from becoming even worse than it is, and we can save the lives of all of those 1.5 million children if those resources are forthcoming.
Christiane, we're going to have to leave it there. Thank you so much indeed for bringing this to our attention. And let's just hope that you as UNICEF and the organizations that you're working with and governments, that you can get the assistance that you need. Thank you so much for your time.
Thank you so much.